It's a Northwest lifestyle weekend on Como News. IRG's Health Talk continues.
We are back, and our first guest is Dr. Adam Sangeorzan, an orthopedic surgeon specializing in treating conditions of the foot and ankle from the Orthopedic Physicians Associates, and we're talking about the aforementioned Lisfranc injury, and Cam Newton is one of the more prominent athletes to suffer from this.
Yeah, suffering from it right now, and I think he may have surgery. They may elect to have surgery. I think they were treating him conservatively. They may do surgery now.
All right, we're going to talk to Dr. Sangeorzan along with Shannon O'Kelly.
Dr. Sangeorzan, welcome to Health Talk. How are you?
I'm doing great. Thanks for having me.
Thank you for joining us. Hey, you're a new practitioner, a orthopedic surgeon with an emphasis in foot and ankle surgery. We're going to get into our topic, which is going to be, for you listeners out there, it's going to be Lisfranc injuries. But I want to talk about your practice. I mean, you recently relocated. You grew up here. You were trained outside the area, just joined a practice in Seattle. Tell us about your practice.
Yeah, that's exactly right. Again, my name's Adam Sangeorzan. I am an orthopedic surgeon. I am a local kid, but I did my training in orthopedics here, but I did a year of subspecialty training at Harvard and Boston, and now I'm back here, and I'm really focused on pretty much all foot and ankle conditions, but interest in general trauma care, which transitions really nicely into Lisfranc injuries. I love that injury and thinking and talking about it.
Right. So when you talk about your additional training, that's what we would call fellowship.
Yeah.
And all the orthopedic surgeons, probably 99.9% orthopedic surgeons coming out of residency programs in today's world are doing that enhanced education called that fellowship. And your training is 1 year with an emphasis in just foot and ankle.
That's exactly right.
Wow, you know a ton about the foot and ankle then, don't you?
Well, I don't know about a ton, but I certainly think about it a lot. Yeah.
Well, let's talk about the topic today is Lisfranc injuries. So let's talk about it kind of just from a medical term, and let's do some anatomy, let's do some mechanism of injury, treatment. We'll go through that whole scenario. Tell us about Lisfranc.
Sure. I think that's a great way to start is you got to know the anatomy and the function of the foot first. So, the foot has to function, and in order to do that, it has to be a rigid lever arm to help us propel ourselves through space. Also has to be accommodative enough to absorb shock and allow us to walk on uneven ground. The Lisfranc complex is very important in that because it helps us with being a rigid lever arm. And if you can picture in your head a Roman arch, or if you think about what the outside of the Colosseum looks like and you zoom in on that picture, you can see a stack of blocks that form a very inherently stable arch. And I think that's a lot like what the Lisfranc complex looks like, and those are what the cuneiform bones look like. Those bones are connected by very strong ligaments to the long bones that run out to your toes called the metatarsal bones. And together they help us form a really rigid lever arm for push-off and also help us maintain that arch of our foot that's so important for us to be able to function and do athletic activity. Any injury to that area, because that area sees so much stress, can be very debilitating to people.
So great job. I mean, as far as radio goes, setting up that anatomically, great job. Great visual look, that arch, that formation of the arch with those bones. So what you're saying, an injury, what happens, you could get those ligaments that connect those bones tear, and that arch essentially collapses.
Correct.
Or becomes separated, or whatever happens there.
That's exactly correct. So I think there's two classes of Lisfranc injuries. One is a purely ligamentous injury, which is what we usually see in sports injuries. Recently, Cam Newton most likely had that injury, although I don't know. Or you can have fractures of the bones in that area to the cuneiforms or the bases of the metatarsals. And the gist of it is now it's unstable, and you can lose that arch, develop arthritis, and have disability.
And a lot of these injuries, the mechanism of these injuries, let's talk about that because it's a little bit traumatic. It's usually you're up on the balls, you're like a football player blocking or someone landing wrong, et cetera, et cetera. Let's talk about the mechanism of injury.
That's exactly right. So the classic, at least lower energy mechanism is termed an axial load on a hyperplantar flexed foot. So if you want to visualize that, you think about standing on the tips of your toes and then having a heavy weight drive directly down onto your foot. So if you think about an offensive lineman pushing on someone, or if you actually watch the injury of when it happened to Cam Newton, you'll notice that he's scrambling to the right, falls down, his foot is kind of planted in the ground with his toes, and somebody seems to fall just kind of gently on the back of his foot. Looks benign, but you got to remember these guys are big and fast, and that this injury can happen to them where you wouldn't think it would happen to one of us.
We're going to continue talking about Lisfranc injuries and more orthopedic issues with the foot and ankle with Dr. Adam Sangeorzan and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
All right, we continue talking about Lisfranc injuries and other foot and ankle issues with Shannon O'Kelly and Dr. Adam Sangeorzan.
So, Dr. Sangeorzan, thank you again for joining us, and great job on setting up the description regarding a Lisfranc injury. We know that it's the arch of the foot. There's some kind of instability or dysfunction or injury there. You talked about the mechanism of injury. It's usually an athletic event. But what are signs and symptoms?
So the diagnosis of Lisfranc injury is something that you have to do and be very careful not to miss. But the signs and symptoms that you typically see are the patient has a difficult time bearing weight. They have pain across the midfoot. They have swelling across the midfoot. And one typical sign that you'll sometimes see is bruising in the middle of the foot, on the bottom of the foot, which is highly suspicious for that injury.
I would imagine when this occurs, that athlete or that patient is going to have some pain. And do they describe pain and maybe some popping or any kind of feeling of pop in that midfoot area because that ligament is rupturing essentially sometimes?
Yeah, you will sometimes hear them say a pop, and like you said, it's pain across the midfoot and difficulty putting weight down on the foot that they see.
From a diagnostic standpoint, obviously signs and symptoms, history is a big part of what you're doing. But x-rays, MRI, what's your favorite tool there?
Well, typically when someone comes in with these symptoms, you'll get a non-weight-bearing x-ray, and in a ligamentous injury, that will sometimes not show instability. So it's very important if you have a high index of suspicion for this injury to get a weight-bearing view or a stress view to see if you can see instability across that Lisfranc complex. Because if you do, they're likely to need surgery.
Let's talk about how you probably grade as an orthopedic surgeon with an emphasis on foot and ankle. You probably use some kind of grading system on these injuries. And tell us about the grading system and the need for treatment or maybe even surgery.
Yeah, well, I think that you could get into a lot of the weeds with this particular question, but I think the simple way to think of it is these injuries are either stable or unstable. In a stable injury, that's when you're getting these stress views, weight-bearing views, and you're not seeing any difference in the shape of the joint complex, whereas maybe you have an MRI that shows a sprain to the ligament there. Those typically do not need surgery, and that's kind of important classification one. Second classification is if it is unstable, then it's most likely going to need surgery. And I think that's the thing that you really need to sort out when you're diagnosing these injuries.
So the non-surgical ones, probably immobilization, let the tissue heal, some rehab. Let's talk about the surgical ones because that makes it more complex because it's a very important area of weight bearing and push off.
So absolutely. This area of the foot does not tolerate any amount of anatomic imperfection, so you've got to make it perfect in surgery.
So you're putting that arch back in place with hardware. Do you repair the soft tissue?
So typically you do not directly repair the ligaments because it's hard to get to the plantar ligaments, which are the important ones. There are different ways of fixing them, and there are some suture bridges that can recreate that injury. But in general, we're not repairing those ligaments. We're just holding the bones in place so that the ligaments can scar in and heal.
As we wrap up here, great information. Tell us about return to play. 6 months, 8 months, a year. This is a big thing sometimes.
It is a big thing. For a stable type injury, typically patients aren't going back for 3 to 4 months. So those are the patients without getting surgery. People who do get surgery, I think that's longer. That's more like 6 months to a year. And that all depends on the amount of injury and the athlete involved, of course.
Wow, great information. Dr. Sangeorzan, again, thank you so much for your time.
Thank you very much for having me. It was great.
Well, as somebody who's going through a foot and ankle issue myself, it's good to hear from Dr. Sangeorzan. You can reach him at opaortho.com. Lots of stuff can go wrong with the foot and ankle, as I found out, and Lisfranc is one of them.
Boy, when you hurt your foot, don't you appreciate the value of standing on your feet?
Absolutely.
Oh, my God.
We have our next guest coming up on Como.